One of the nice things about it is I can take all my data. We have over 150,000 visual fields used on other perimeters. We've been able to download it into our server and be able to integrate it with the visual fields done on the Octopus. So I can do a sequential look at the visual fields. And while I can't analyze them, I can certainly look at them and get an overall gestalt on how well a patient's doing or not doing, and I can share that information with them. And there have been at least a couple situations where it has been helpful for me to show that a patient may indeed be progressing where I may have missed it otherwise.
I would say the biggest way that I use it is really in terms of patient education. It's changed the way I show visual fields to my patients. We have a system in my office in which we have flat screens on the wall, and their visual fields are projected up there with the beautiful images that the Octopus makes with the EyeSuite. And I can show them their fields, and I really think they have a better understanding that way.
We use Octopus with EyeSuite for all of our patients. We're an electronic medical records environment, and when I'm in the room with the patient, I have EyeSuite pulled up on the computer. I can look at the patient's current exam and then in just a couple clicks, literally 2 clicks, see a series of their previous exams, and there are tools within EyeSuite that make it very easy for me to identify areas suspicious for change and very quick to drill down more specifically. Now when I want to see whether the patient's worse over the last 3 fields versus 6 fields or 9 fields, I can do that in just a couple quick clicks, literally a couple seconds, whereas before I had to ask my technician to reanalyze the fields or to print out another series. So it's really saved me a lot of time that way.